some technical difficulties here. My name is Kirby VI. I'm with the department, and I'm actually signed in under this meeting under Amy Holland, but it's Kirby VI. Just a few housekeeping things I want to go over. First, welcome to the Region 7 Planning and Policy Council meeting. I'm glad that you could all make it, and it's nice to see faces, especially during this time. Just a reminder, this meeting is being recorded per Governor Lee's Executive Order 51, and it'll be available on the department website within the next couple days. I just want to remind everyone, if you are not talking or presenting, could you please mute your phones or your computers, because the feedback gets to be a bit much after a while. I appreciate it. And then obviously, if you have a question, please unmute your phone before you ask it. Butch, I saw that you were taking some attendance as you saw participants log in, but I'm going to go ahead and, I'm going to go ahead and read through them as well, just so that we can have it on the recording, because the recording won't show this participants list. And we could just double check to see if we have the same people, if that works for you. I have me, Kirby VI, like I said earlier. I have Allison White, Avis Easley, Bartholomew Allen, Butch Odom, Cecilia Johnson Powell, Eula, did I pronounce that correctly? Eula Lee Whitaker, Jason McCown, Jakarta, I love that name, by the way, Justin Johnson, Kevin Spratlin, Kubra Urkel Bryant, Kurt Hipple, Lincoln Kaufman, Lindsay Blevins, Marta, is that Marta Hernandez Fontenot?
Yes.
Hi, Marta. Tom Starling, Zach Blair, and I also see two individuals that called in. I know one of them is Bartholomew Allen. Is there anyone else that called in?
Yes, it's Victor Adams from Compass.
Victor Adams, welcome. All right, Bart, I'm going to hand it over to you.
Sounds good, thanks. So I just want to welcome everybody. I appreciate you calling in. I know it's been a hard time, but we definitely want to give everyone big kudos for calling in. It's really big, so thank you so much. You probably received an email from Butch earlier last week. And in your email, you would have today's agenda along with our minutes from our last meeting. If you can get those ready, we'll do a quick welcome and introduction, and after that, we'll go over the approval. So once again, my name is Bartholomew. I am the chair for Region 7. Hey, Marta, we can see you. The chair for Region 7. And on the phone, we have Butch. He's our big-time secretary. I think we need a better title than that. Butch does a little bit of everything. He's like Superman. And then our vice chair is, I don't know if she's on the phone. Is she on the phone? Hey, Mary. Is Mary on the phone? Maybe she'll call in later. We'll start there.
No, Mary's on.
Go around. Does everyone want to go around and introduce themselves?
I think we lost you, Bart. I think Mary's on leave. She sent me an email. I think she's on leave right now.
Yeah. Can you guys hear me?
I can hear you now.
Good. I'm sorry, my phone is crazy. So we'll get started. We'll just kind of come back. So if you have in front of you the approval, if you have in front of you the minutes from our last meeting, if you can kind of take those out and peruse through them real quickly. And if we can get a motion to accept those once you finish, that'll be great. We'll take a couple of minutes just to look back over everything. If you don't have the minutes, I can forward them to you really quickly. In the chat box, you can just you can email me. You can send me your email address if we missed it for some reason, or we can send it out real quickly. It's not a big deal. Okay, if we've had enough time to review the minutes, can I get a motion? And when you make a motion, do you mind stating your name for our record so that Butch can record it?
Tom Starling moves.
Thanks, Tom. Do we have someone to second that?
Lincoln Kaufman, second.
Hey, Lincoln. Thanks, Lincoln. Butch, did you get both of those?
I got both of them.
Great. Thanks, both of you guys. So in your packet that Butch sent out, once again, you have your agenda. We have our minutes from our last quarterly meeting. You should have the attendance of the members that were on our last call, along with our needs assessment worksheet that we sent in for this term. There's a couple of other documents. It was about 3 or 4 pages of the needs assessment, if I'm not mistaken, maybe a little bit more. So if you haven't reviewed them, please do so at the time. I won't be on here long. Mr. Butch will take over, or Mary. Mr. Butch will take over at 11:30 in my absence. I have another meeting. But as of right now, we are definitely on track. We're going to have Mr. Zach Blair come and give us the updates for the state.
Good morning, everybody. Thanks for the time this morning. Wanted to do a quick legislative update for you. First, want to apologize that the legislative summary is not complete. It will be complete. This year was a little different, mainly because pause due to the COVID pandemic. We had an initial session that lasted through the 3rd week in March or so, and then the legislature adjourned until June 1st and came back to take up the rest of the business that was remaining. So due to the lateness and adjournment, it took a little while for public chapters and bills to get completely engrossed and done. That's the reason for the delay in the legislative summary this year. But I was able to pull a past bill report for the regional councils. And again, we'll email the full summary to you once it is complete. And again, I think that's going to be a matter of days. But I'll touch on a couple pieces of legislation that hopefully the group will find interesting, and then be happy to take any questions regarding the session this year, as long as you need me to do that. So I'll get started with a few bills, and again, please let me know if you have questions about that. The first one is Senate Bill 673, House Bill 787, and that was a bill that will require the Department of Veterans Services to have their employees undergo training for suicide prevention for those employees who directly interact with veterans. I know folks are very aware of the crisis that we have with veterans that are taking their lives due to suicide, and that's hopefully something that will help with that and assist the Department of Veterans Services, specifically those who deal directly with veterans, in recognizing those signs and being able to provide them with the proper resources if that is a concern when interacting with those veterans. There were a couple sunset bills, and if you're not aware of what that is, the state government review law requires the legislature to reauthorize government agencies on a regular basis. And those typically are anywhere from 1 year to potentially 6-year extensions. They go through an audit process and a hearing with the legislature, and a bill is required to continue those agencies after their expiration date. So just a preview, our expiration for the Department of Mental Health and Substance Abuse Services is June 30th of 2021. So we will be going through the sunset process late this fall for our hearing, and then during the session next year, there will be a bill to determine how long the department's extended. So this year, Senate Bill 1655, House Bill 1733, the Board of Social Work licensure was extended until June 30th of 2026. Also, Senate Bill 1659, House Bill 1737 extended the Commission on Children and Youth to June 30th of 2024. And then a couple programs were extended for the programs that TennCare provides. Cover Kids was extended till June 30th of 2025. Also, the Access Tennessee Health Insurance Program was extended until June 30th, 2025. Other bills that I'd like to touch on, two of the biggest bills, and I'll try to go over these back to back. But Senate Bill 1060, House Bill 656 is a bill that will allow nurse practitioners and physician assistants to prescribe buprenorphine in community mental health centers and federally qualified health centers. And there are quite a few limitations to that as far as dosage, type of product, direct supervision by physicians. But that will be a large expansion of practice for buprenorphine prescribing in Tennessee. Prior to this bill, we were the only state that didn't allow nurse practitioners and physician assistants to prescribe buprenorphine. And so this will hopefully assist with capacity at those particular facilities and being able to treat folks with medication-assisted treatment with the use of buprenorphine. The second bill on that same subject, Senate Bill 1938, House Bill 1980, again allows nurse practitioner and physician assistants to prescribe buprenorphine in licensed OBOTs. And again, there are several conditions about that need to be reviewed by licensed OBOTs, but that will be an opportunity, again, for more expansion of medication-assisted treatment with buprenorphine in those licensed facilities. That bill also went a step further and will prohibit cash payment for services at licensed OBOTs. Cash now can only be used for copays and prepaid debit cards, gift cards are in the same way, can only be used for copayments rather than cash payment for services. And it also requires those licensed OBOTs to be credentialed with TennCare and bill TennCare for reimbursement for services when providing MAT in those facilities. So that's another that should make a big difference in those particular facilities that are prescribing buprenorphine for MAT. Senate Bill 1912, House Bill 1917 requires that healthcare practitioners disclose and explain the alternatives to using opioids, such as occupational therapy, interventional procedures, alternative treatments before consent is obtained to treat with an opioid. Additional bills that I think this group might find interesting. There is a bill that will require folks that are interacting with the Department of Children's Services, if there's a parenting plan that's entered into with the court, the parents of that child would have to watch a 30-minute video on adverse childhood experience that would be created by the Department of Children's Services in conjunction with the Tennessee Commission on Youth and the Building Strong Brains public awareness campaign. Additionally, a big change this year, Senate Bill 2202, House Bill 2269 was an administration bill that changes state law to mirror federal law when it comes to purchase of tobacco products and raises the minimum age from 18 to 21. I don't think many people are aware, but the department is charged with making sure that we participate with the Department of Agriculture, who has jurisdiction over retail tobacco sales, and the state must maintain a level of compliance with minor sales of tobacco products. And there was concern that the Department of Agriculture wouldn't be able to enforce that if the state law was not changed to reflect the federal law. And a lot of people are not aware either that some of our block grant funding is tied to compliance with underage sales of tobacco products. So this is hopefully a cleanup that will allow us to continue to do that, and will maintain our ability to assist the Department of Agriculture with their enforcement of that law. There, Senate Bill 2552, House Bill 2625 requires the Department of Mental Health and Substance Abuse Services, the Department of Health, and the Division of TennCare to collaborate to develop educational materials to providers and facilities of MAT for NAS awareness. So that's something that we will be collaborating with our sister agencies to be able to do that. Senate Bill 2734, House Bill 2517 made some sentencing changes to the school safety zone, possession and sale of drugs. So that's a pretty significant change on the criminal justice side of things. And then finally, two joint resolutions that were passed by the General Assembly. Senate Joint Resolution 181 that recognizes the need for mental health parity in Tennessee. And then finally, House Joint Resolution 1 that recognizes teen suicide as a health crisis in Tennessee. And while those are resolutions that don't specifically require or direct state agencies to do something, there are policy statements by the General Assembly that I believe folks will be very important, both on the mental health parity side and the teen suicide as a crisis in the state of Tennessee. So those are the bills that I wanted to cover today. I'm happy to answer any questions about those bills or other things that went and proceeded in session. But that's all I have for my list. And again, happy to take any questions.
Hey, Zach, this is Bartholomew.
Yes, sir.
Yeah. I didn't quite hear the comment you made about
Bartholomew, I apologize, but you're breaking up quite a bit, and I'm having trouble hearing you.
I'm sorry. How about now?
That's much better.
Okay, good. I didn't quite hear the connection between the Department of Agriculture, if I'm not mistaken, and the Department of Mental Health as it pertains to tobacco sales and enforcing that. Can you kind of go back over that?
I'll be happy to. So the Department of Agriculture is the state agency that is required to enforce regulations and laws related to tobacco retailers. And we, as the Department of Mental Health and Substance Abuse Services, we are required to assist them with the secret shopping and the underage buys that allow us to determine the compliance rate for the state. And the compliance rate for underage sales with the state, they are that number is tied to the block grant funding, substance abuse block grant funding that the department receives. So if the state didn't maintain a minimum level of compliance, it's potentially a possibility that our block grant funding could be in jeopardy. So in order for the Department of Agriculture to continue to use their enforcement power as it relates to tobacco retailers and the new age requirement from the federal government, they believe that the law on the state level needed to be passed as well to ensure that will happen. Does that make sense?
Oh, wow. Yeah, that does. I didn't even know that. Wow. All right.
Hey,
Thanks.
Zach? Zach?
Yes.
It's Kirby. Tom Starling submitted a question in the chat box feature, and he asked, hold on, it just went away. He asked, did the art therapist bill pass to create their own board?
That's a good question. I remember the, let me look. I remember who sponsored that bill, and let me see if it looks like that bill was taken off notice. Don't believe that bill passed. That was one that we were tracking, and I don't remember seeing it on my list as a bill that passed and became law this year. It looks like, House Bill 781 was the bill that created the Professional Art Therapist Advisory Committee within the Board of Examiners in Psychology, and it was taken off notice in the House, and it was deferred to a later study committee in the Senate.
Thanks, Zach.
You're welcome.
Bart,
Yeah.
I have some department updates as well. Do you want me to just go into that?
Yeah, sure. Go ahead.
Okay. It's Kirby again. Before I go into the department updates that I have, I saw 2 members join. I just want to make sure that we get them for attendance for you all. Mary Neal, she's here. And John Jackson entered the chat as well. So that's for you, Butch, for your attendance. You may have already gotten that.
Yeah, I've got them. Thanks.
You're welcome. Okay, so I just have a few updates from the department. Thanks, Zach, for your legislative update. So the first update I have concerns the department's joint annual report. Each year, a joint annual report is produced and delivered to the governor and state legislature that lists accomplishments, challenges, and plans for the future. The joint annual report is a collaborative effort between our department, the regional councils, and the statewide council. I will be sending out an email with this too, but I would like for you all to start thinking about it as well. If you could submit this information for your specific regional council, so challenges, accomplishments, and plans for the future for Region 7, no later than September 18th, that would be great. I know it's a good bit away, but you know it'll be here before we know it as well. So if you all could just start thinking about that and submitting that information, that would be great and very helpful. Year 2, fiscal year 2021 of the 3-year plan is in progress. Regional councils will have an opportunity to review within the coming weeks. Development of the FY 2021 mental health block grant is underway. Statewide and regional councils will also have an opportunity to review in the coming weeks. Like Zach just said, the 2020 legislative summary is in the final stages of completion. Once finalized, the legislative summary will be posted on the department website. I'll also send out an email to you all with the link to access that so you can share it with your council members. The department is receiving a $2 million federal grant to provide additional services in response to COVID-19 over the next 16 months. The funding will be used to bolster the state's existing crisis services continuum, behavioral health safety net, and substance abuse treatment and recovery services. The department's grant proposal included a comprehensive implementation approach, which includes 5 facets: assessment, capacity, planning, implementation, and evaluation. Services will be planned, developed, and delivered with a special focus on telehealth treatment to ensure statewide availability. The department is receiving almost $1 million from the federal government to support the mental health needs of Tennesseans living through the COVID-19 pandemic. The grant for $966,380 is through FEMA Crisis Counseling and Training Program. The funding will provide outreach and support services in all 95 counties in Tennessee. Department staff will be working with community behavioral health agencies to deliver these services. And lastly, Tennessee's healthcare workers and first responders who are on the front lines of the COVID-19 pandemic response have a new resource to reach out to about feelings of stress, anxiety, sadness, or depression related to work. The COVID-19 emotional support line for healthcare workers is available to call at 888-642-7886. The support line is a collaborative project among the Mental Health Active Response Team, otherwise known as MHART, the Tennessee Association of Alcohol, Drug, and Other Addiction Services, also known as TADIS, the National Association of Social Workers, Tennessee chapter, and the department. Specially trained mental health professionals who answer calls through the line can provide emotional support through active listening, help callers identify and address basic needs, and provide reference tools for managing stress and making a plan for self-care. It is important to note the support line does not offer mental health treatment, and it is not intended to replace mental health crisis or suicide prevention services. That's what I have. Butch, I'll be sure to send these to you in an email as well for your minutes.
Thank you.
All right, thanks, Kirby. I appreciate it. Does anybody else have any updates from the state, Kirby?
I believe that's it.
Okay, great. We are definitely on task. At this time, we're going to start our agency presentation. This young lady was referred by Mr. Butch Odom. Heard a lot of great things about her. Her name is Cecilia Johnson Powell. Is Ms. Powell on the line? Cecilia?
Thanks, everybody. I was doing double duty. You know how we all are. So I appreciate this time, and I don't expect to last very long. I think that we can get through this. But thank you, Butch, especially for inviting me, and very grateful to be involved with this wonderful council. You know, the work you're doing here is significant, especially now, as you mentioned, when there are so many people that are stressed out with general anxiety and real severe specific anxiety about what will happen to their children and their families and themselves during this time. So I am going to pull up this presentation. It should not take long, and of course feel free to ask questions throughout this process. Let's see if I can do the technology thing. I'll share my application. And let's see how it works. Share. So just to confirm, right now you see a white screen with nothing on it. My presentation is loading. As soon as we do that, we'll get started here.
Okay.
You know, it's funny how seconds can seem like minutes when you're in tech space.
You're doing fine. It's coming through here. Yep.
Time seems to drag. It's like slow motion, you know?
Yeah, you're good.
But thank you. All right. So everyone should be able to see the Impact Poverty screen and the beautiful young lady with the Driving the Dream and the United Way logos. Please let me know if you can't. First of all, this presentation is about driving the dream. I'm sure many of you may have heard about Driving the Dream. We've discovered that many people don't know what it is, even if they have heard about it. So first of all, Driving the Dream is an initiative of United Way of the Mid-South. I think many people in Shelby County have heard about United Way of the Mid-South. Our executive is Dr. Kenneth Robinson, MD, or Reverend Kenneth Robinson, MD. A lot of people know who he is. Driving the Dream has been something that this United Way started on 5 years ago. At the time, the goal was to be able to help move people out of poverty from where they are to where they dream to be. And that was the general vision. We want people to have equitable access. As we move forward 3 years, a group of people within the Shelby County Department communicated that they wanted to be a part of that process. And so we brought together a number of providers as well as users of services and other kinds of stakeholders to talk about how we could actually move people forward from where they are to where they dream to be. And that group developed the vision, the mission, and the goals. And I know that you all, a lot of you are mental health or substance abuse service delivery agencies. And so you understand that these goals are very lofty. They're very aspirational. So in today's environment, however, equitable access has become synonymous to economic justice and racial justice. And so we believe very strongly that equitable access is essential to ensuring that people have the ability to conduct their agency and develop for themselves what their hopes and dreams are and move toward that. The mission of Driving the Dream, the initiative itself, is intended to align and integrate these local service delivery systems so that we can support families in a more effective and efficient way. And the outcome is that people are hopeful, resilient, and self-sufficient. Now, again, aspirational, those goals and outcomes do reflect the goals that we have overall. So, exactly what is Driving the Dream? It's an operating intermediary for the human services sector. And by that, we build networks of partner agencies throughout this community. We are the driver of supporting capacity building for agencies throughout the community. We provide a technical infrastructure so that agencies can actually leverage the resources that we provide. And we also operate as a funding conduit for direct service providers. Basically, Driving the Dream is a network. We are an initiative that connects one agency's resources to those of another agency. We use an online web-based database to partner with agencies so that they can upload their program information, upload the information that they have around eligibility, capacity, what their programs are intended to achieve. Like I said, who's eligible, how long the program lasts, who's involved with it, and we combine the information from all of those programs into one database. Very much, you would say, like 211. The difference between us and 211, we are an online database, but we also provide client intake and access. We ensure that people can actually make referrals. Agency staff can make referrals on behalf of clients directly from their desk electronically to the agency that they want to refer them to. We have more than 185 programs that are represented from 73 agency partners, including Shelby County Schools. So we have quite a few partners in the agencies who are looking at us as an opportunity, a way to connect their clients to a wide variety of resources that are available to them, not just the resources that they know about based on their contacts with their colleagues in the community, but they actually have a wide variety of resources available so that when individuals do come to them for assistance, when they talk to them about what they need, not only do they need mental health or substance abuse support, they also need transportation, or they need childcare, or they need housing, food, then we have the actual most recent list of resources available to them. Not only that, so we've got this technology data center in the web that's free for our partners to use. We also provide engagement and technical assistance and training. So we are providing support people, for the staff, so that they know how to use this system, as well as providing them training on motivational interviewing, best practices for building out of poverty, etc. So that's what we are. We are a network. We are a network deliverer, an operating intermediary. This is the best kept secret since sliced bread. So one of the things that we do, I told you that we've got this big network that we use so that folks can access the data and then make service delivery through this process. And we also follow up and do a closed loop referral process. But we also use this two-generation approach. And this paradigm for us is about making sure that folks understand that families, most of the people that have needs are not just asking for themselves, but asking for their children and their household members. And we want them to be able to address the needs of the entire family and make referrals on behalf of any member of the entire family. So we continue to conduct training, building relationships, building engagement opportunities for the partners that we do have. It's a wonderful process, and we're very thrilled about it. We'll talk a little bit more about that, what that means as we go forward. This is two-generational network of partnerships might look like. There are 5 specific areas. We've combined them into 4: social capital, education, health and well-being, and economic stability. Sorry, I keep moving this. But our particular partnerships are organized around one of these 4 or 5 partnerships. We have quite a few, and we'll talk about that in just a minute. But I wanted to make sure that you're aware that this is what we focus on when we talk about building partnerships and developing relationships. So we actually have 73 partners, but many of those partners have more than one program, and some of the programs have multiple domains, or they have multiple programs and one program in each domain. So for example, in health and well-being, you'll notice that we have 13 programs, one of which is Church Health, 18 programs and agencies that support economic development. That includes workforce development, tax preparation, financial literacy, and etc. Education includes early childhood education, youth development education, post-secondary education, and then family and social capital are also around youth development, community partnerships, peer groups, mentoring, group counseling, faith-based organizations, etc. So what have we done? So we are funded by the Tennessee Department of Human Services. That's one of our largest supporters. We have a grant designed to actually launch and implement this process. We received that grant in year 1, quarter 1 down here, October of 2019. And the data that we're showing here is through June 30th, 2020. You will see here that we provide support. Then the blue numbers are the referrals that we've actually made each quarter in our system. The actual individuals are referred to the red line, and then we also have family members that have been impacted. And so we are seeing, what we've seen is quarter after quarter, nearly doubling our support, except for this last one, which is no surprise to anyone. Every quarter, we are increasing in the number of network partners that we support, as well as the number of individuals that are supported through these partnerships. Some of the notable partnerships here in Shelby County. I think you would be surprised to learn about who we're partnering with in some way or another. Again, these partnerships are organized around the 2-gen domains of education, economic supports, workforce development, health and well-being, social capital. Many of them I'm familiar with. And there's just about a program for just about anyone that has a need. Are there any questions about that so far? Okay. One of the things that I think is on the mind of us is the United Way's response to Driving the Dream. Driving the Dream currently has a staff of 11. I lead a team of 11 individuals, 2 associate directors. One of them is related to relationships. One is related to data and quality improvement, and a team of agency relationship associates as well as a team of data and quality improvement associates. What we have done with our team during COVID-19 is pivot from our direct engagement work to supporting the COVID-19 response. What we initially did was to create a call center so that we could actually provide a front-facing portal for individuals who wanted to actually get the intake opportunity, make referrals directly based on their need. We also created an agency matrix of needs so we could get some grasp of what was going on in the community. We created an information sharing process through the e-newsletter, and we also provided direct agency support. And by that, early on, that demand was for, of course, toilet paper, hand sanitizer, paper towels, and other personal protective equipment. So some of that need is still there, and we'll talk about that briefly. So this was driving the Dreams response. Remember, DTT is an initiative of United Way. So we did this call center initially. It is currently still up. You may have heard an ad about it here on the radio. We have started to promote this. We launched this on April 13th. Our DTD staff completes an intake and referral process for people that call. We have received 1,600 calls roughly in 90 days. And the priority, I know you're not surprised at all, is about income, shelter and housing, food and employment. This has shifted a lot. Last 90 days, the initial request was for food and income, and then and healthcare, believe it or not. And now in the last week or so, it's moved straight into income. They need more money. They're concerned about housing and evictions, and that is reflected in the types of calls that we receive. That is ongoing, and we will continue to support that. The next item that we wanted to make you aware of was what's going on in the community around agencies and their operational status. This is where you get to learn. This is updated every week or two, and most recently it was updated through the end of June, and at that time, 60% almost of agencies were operating remotely. Another 22% were operating, but only served a fraction of the clients they normally did. Only 13% were opening and operating at full capacity, and another 5% were closed. At this stage in the game, 80% of the folks are feeling very uncertain about what's going to happen in the future. They still don't know what the status of their agency is going to be or how they're going to meet their needs, but they are pivoting towards moving to a full-time remote access process. All right. So what did we learn in the last 3 months? From talking to people, we've learned that there is an increased demand or support from individuals that are 41 to 60. New people who have never had to connect with Health and Human Services or any human services agency are coming into the system. Many of them are unemployed, and I do want to make that distinction between those that are unemployed and those who are not working or have never worked or have other income. More of the people that we see have a higher education. A surprising number of the clients that we see are actually high school graduates. But in this case, we're seeing more people who have some training certificates or post-secondary educational skills. And we also have a higher percentage of people 3 months ago that are not working now, and they're looking to go back to work. All right. What does that mean for us, and what does it mean for you? Not surprisingly, there is an increase in the number of calls through the Crisis Center for Suicide Prevention, drug and alcohol overdoses, mental health assistance. So we intend to formalize a call center or a contact center and make it a permanent part of the work that we do. We don't think we'll be doing it internally. We will probably find someone else to do that, but you can look forward to that. We also want to talk about workforce development issues. At the end of the day, folks are still looking for work and they may need to be retrained. And so we're partnering with the Chamber of Commerce, a couple of other folks, to help them launch their Upskill 901 and to use our system to help their individuals find the resources that they need to support them as they look for work. Partnering with the medical field or the healthcare field, if we can, to help them address social determinants of health issues. And many of you, I'm sure, are familiar with what those are, but housing, clothing, food, education, employment, all of those impact a person's health outcomes. And so we're working to help address that. We have, again, onboarded the Shelby County School staff. We have a number of partnerships with 3 or 4 of their divisions, but we want to continue to onboard them and to get their people in the process of engagement with Thriving the Dream so they can have this resource available when their parents or students come in and indicate that they've had issues outside of education that they're dealing with. We want to do this bullet number 4 is about doing a community integrated system. I believe, honestly, I'll tell you this, that equitable access is economic justice. And when we are willing, we need to work together to figure out how to share information among the human services partners so that we can, in fact, provide that equitable access. And of course, we're always going to seek sustainable support for our current status. I think that's all that we have. If you need to reach out to me, of course you can electronically, but you know how to reach me. But you all also can reach me directly. My information is on the United Way website, along with Tawana and Eric, many of whom you probably have met at some point. And thank you for this time. I appreciate it. Butch, I'll hand it back to you and answer any questions that you may have.
Cecilia, thank you so much for that very informative presentation. It was really helpful.
So I'm hoping that you all can see me. I'm done with that presentation. Are there questions?
We can see you. Feel free to put them in the chat or to speak up.
Cecilia, can you hear me?
I think she's on mute right now, but I think we're
in chat.
Hello, Cecilia, can you hear me? I have a question. I'm not sure if you can hear me, but I'm going to ask the question. The question is, I work for the Hispanic community a lot. And my question is, do you have any of these resources available for the Hispanic community if I refer someone to your services?
So Marta, can you hear me okay? Yeah, so part of one of the ways that the Driving the Dream program works is they have agencies like Church Health, and we're very new in this, that that employ what they call care hub coordinators. And there's 5 agencies in town. I think it's 5 agencies. Port of Leith, Neighborhood Christian Center, Catholic Charities, Church Health, Communities in Schools, I think. And we came on as to provide a care hub coordinator who's bilingual. And so one of my, I brought on a young woman who speaks Spanish fluently, and she's going to be a primary part of her job community and help them find what resources are available to them.
That's awesome. Thank you.
I know this is
everybody. Hello, I'm back.
Okay.
You may have moved on. No,
she was asking about our bilingual care hub coordinator for a few minutes. I made everybody believe that I know a whole lot about Driving the Dream.
Well, hey, you know what you do? We all do. So I'm so sorry. I just the sound was dropping out, and so I just went ahead and called in finally. So I apologize. I know there were a couple of questions that I could see forming. Do I need to respond to those, or Butch, you got it?
Well, I got the question about the Care Hub. I think. Are there any other questions, folks?
So Bush, you will be the person that I contact? I mean, Church Health Center will be the place that I contact?
Yes. Now our contract started on July 1st, and we're just starting to get trained, and so and our person on our team will be in another 2 or 3 weeks. Hello, did you want to come join the meeting? Any other questions? Well, Cecilia, I thank you so much for this. This was a very informative presentation, and many of the people listening in work with folks who are trying to move along a pathway of improvement, and to know that this is a good option, or an option out there for people in our community, is really helpful.
Presentation. We get so excited about it. We just am very glad to have an opportunity to communicate with you. And I know I've got to go to another meeting at 12:30. Otherwise, I'd stay on and be happy to answer your questions. But Butch, again, knows our contact information if you need anything else. Thank you for allowing me to participate.
Thank you, Cecilia.
All right, y'all have a great day.
Do you have the agenda up, Mary?
I do, yes. Next on the agenda, we are going to talk about COVID updates, discussion. Does anybody have anything that they want to share from their agencies regarding current status and how everyone's doing?
Hi, this is Marta. Our agency is actually only having the people from the Housing Alliance. What we're doing is just the housing bring the people over here, and we do groups as usual, but we are not having more than, I think, 15 people, no more than that. But we continue with the program. The calendar is the same. Don't do outings because of COVID. There is a lot of worry, especially people who are employed. They have worried about losing their jobs. So there's a lot going on, but we're thriving. We'll do what we can.
I think for those of you, some of you know that I volunteer out there, and I've restarted my work out there on Thursdays, and one of the real worries is because they're working with about 40 or 50% of the people that go to Turning Point Peer Support are in private care homes or non-alliance based care homes, and so there's just it's really, we totally understand it, because you really couldn't bring that many people into that small space, but there's a lot of isolation going on among these people, and most of them would fall into that category of severe persistent mental illness. Even though many of them are highly functional, they're off their medications. They're very, very ill. I will say that Bart said, "Hey Butch, I thought you could give us an update on COVID testing," and so. Just like PPE early in the pandemic, in our community, over the last 4 to 6 weeks, many of the companies that were providing the testing, like American Esoteric Lab, not the testing, but the people who were running the tests had supply chain disasters. And a friend of mine across the street, we're pretty sure he contracted COVID. And he had been feeling well for 3 days when he got his test results on day 10. And so that's just, it was just not a way to, so many of the, and when you think about, so I can't remember what I said the last time, but in our testing, we did shut down our testing for 2 weeks. We were testing about 100 people a day, and we shut it down because it was just, we were just adding to the problem. And it's really hard to tell a person, go home and isolate yourself and we'll call you with your results, and then you don't get results for 10 days. And frankly, people just don't do that. They go back to work because, it is going to be so interesting to look at a disease that kills a fair number of people and permanently disables a fair number of people. And for what I think is around 30 or 35% of the people, it has absolutely no symptoms. And yet they can just go out and cough all over us. And it's just going to be really interesting how this works. We only are testing symptomatic people. And I think most of the places are really trying to go back to symptomatic testing only. There's 2 basic tests that are available in town. The initial test that people hated so much was the nasopharyngeal test. And that is literally, if you put your fingers on either side of your eyes, they would go into your nose and they had to get into a sinus that's over here on the lateral part of your eyeballs. It's very uncomfortable. It didn't lend itself to people wanting to be tested because it was painful when they got into the first sinus, and then when they took it out and said, now just one more time, it really did keep people from going. So now they're doing one that's more like the flu test. And we've seen a lot more testing. But really this whole everyone has a right to a test has just really, it is such, I will say, in your own situations, about 40% of the people who are asymptomatic, 40% of the time that there's just a real potential cost to you in having a test if you're not symptomatic. Now, of course, the symptoms are huge now. I mean, the list of symptoms are huge. But I think the other thing that I find very, very frustrating in the community is that really what should happen is if you're diagnosed with COVID, once you're 3 days without symptoms, so once you're 72 hours without symptoms, you should be able to resume your normal life. That means you should be able to just go back to work. My friend works for one part of the county, and he could not go back to work until he got a negative test. Well, he works for Shelby County government. Shelby County Health Department says employers shouldn't be doing that. And so you just have this disconnect between 2 large county agencies saying 2 different things. And I think there has been some new communication around people having testing and when they're not going back to work and things like that. So we'll see. We started testing again today, so we'll see how our results are coming back in. We test Tuesdays, Wednesdays, and Tuesday, Wednesday, Thursdays. There again, if you go to the COVID-19 page on Shelby County, you can see all the locations. But if you there are it's complicated. There is I don't have the names. Locations. One's in Millington and one's over in West Memphis. There are 2 locations that are offering some rapid test where you can get a fairly quick answer. I know Ben Dickey called me the other day wanting to get somebody into a treatment center, but they had to test negative and he had to find a place. And I can't remember. I think it's I think it has red in the title in Millington, and he said, "Well, that's great, Butch, because I have some everybody there that owes me a favor." So,
yeah, Butch. This is Lindsay. It's Red Med, and they're all over. There's some in Millington. I know there's 10. So the Red Med, like urgent clinic, will do rapid testing.
he's breaking up too, I think.
Yeah.
Cool.
Sorry,
Yeah.
a lot of people have been breaking up as I've been trying to listen to. I'm not sure if it's me or what the problem is.
Yeah. But anyways, are there any other people that are there any other questions about testing? Or any other comments from agencies on how they're struggling or not struggling around COVID testing?
This isn't about testing, of course, but of course at Methodist, we've had a huge uptick. We're filling up our critical care beds pretty quickly. We have a good amount of patients that are being housed in the ED because critical care beds are, and they're full. So, yeah, so, I mean, we're still in a steady state. Our PPE numbers are always good. We get daily updates. But critical care beds are, they're full. So we're having to either house them in the ED until a bed opens or transfer them to another facility because there is an open critical care bed. So,
Allison, do you know if they've started using either of the alternative sites, the alternative hospitals that they created? Because I don't think they have yet.
As far as I know, they haven't, the state or whoever's in charge of that hasn't made plans to open. So as far as I know, they're not using it. I don't know what would make them, I don't know what the requirements are for the state to open that facility. I mean, it costs millions and millions of dollars. I don't know.
Yeah. Well, I know that I was at my doctor's office a couple of days ago, and primary care doctors are just dreading the fall when cold and flu season starts, and you've got this myriad of this myriad that all look like strep or COVID or flu, and it's just going to be a mess this fall. So.
Yep.
Okay. Well, Mary, I'll give it back to you.
So I don't know if you already mentioned, Butch, about the membership list. Reminding everyone to fill out a form if you haven't already, because we need to continue to update that and get that to the state. We also wanted to give everybody
What'd you say?
The membership list. Did you already talk about that?
No, you cut out on me.
Okay, we just wanted to remind everyone, I know we sent the email yesterday, but about if you haven't filled out the membership form. Okay. Awesome. If anybody hasn't already filled out the form, please do so. And then we also just wanted to give time for networking, any other updates from facilities or announcements that people want to make so that we're all in the know. Does anybody have conferences or anything that they wanted to share coming up?
I was trying to mute myself again. So Lakeside hosts every Friday a free tea that anybody can log on and attend. There should be more information on our Facebook page or on our website. So we've got Building Stronger Brains coming up this Friday, and every Friday, I think in September, we're going to start going every other week. We'll be having some ethics coming up in the fall. So please check out our website to get more information about that. Lakeside is still open, treating our patients, but we have tried to offer other options for people who are not wanting to come in person. So we've got tele options, not only for intensive outpatient, but also for assessments as well. One is not, or is working with our clients who are not interested in coming in person, share the information with them. And that's all I got for now.
Thanks, Lindsay. Anybody else?
Yeah, so this is Justin over at TSBN. So basically, everything we do now has went virtually. If you need any brochures as it relates to TSBN, you can now order them through TATIS, their clearinghouse, or you can go to our website and they'll be delivered to your home. September 17th, we have our annual conference. It'll be this year through Zoom. Already have 2 confirmed speakers. Cindy McNally, she's through a large nonprofit that basically brings veterans all across the state for preventing veteran suicide. There's actually 3 are a hike in Memphis, Knoxville, Nashville, and Chattanooga. And then Monty Burks is also going to be our keynote speaker with the Tennessee Department of Faith-Based Initiative. And then also, if you need any suicide prevention trainings, I can offer them through virtually and provide CEUs. If it needs to be catered to your organization at a certain time, feel free to send me an email at jjjohnson@tsbn.org and I'll work with you. That's it.
Hey everyone, this is John Jackson with Harbor House. I just wanted to let everyone know that we are accepting clients and that we do have beds available for residential as well as social detox, medically monitored detox. Thank you.
Hi,
Hey,
this
everybody.
is, I'm sorry, go ahead, Kevin.
It's Kevin Spratling with the fire department. Just wanted to throw something out there and urge you, if you're interested, to contact me. There's a lot of discussion in our community about how to make sure that we're connecting folks on the street in crisis with the appropriate resource. And in some cases, that may take the form of having social workers or behavioral health assessors on scene with these patients and how we can facilitate that. So we're having a lot of discussions within the city government of how to do that. Some of you have heard me previously speak about our care team and how we do some of that, but need to do more. So if any of you have thoughts on how we can build a system that will really navigate people to the right resource, putting those social workers on the scenes with these behavioral health crisis patients, and minimizing, in some cases, the only person showing up on scene being a police officer, I welcome that. My last thought on that is, as a reminder, the only medical condition for which we send the police instead of a medical person is behavioral health. And in those cases, instead of sending an ambulance, we send a police officer, and if we offer treatment, we handcuff them and put them in the back of a patrol car. We don't do that with any other condition. So I'll put my email address in the chat box here, and I welcome your input on that topic and would love to hear from some of you about some good ways to approach it. Thanks.
Kevin, thank you so much for that information. I just, on so many levels, Memphis has responded so well to the crises that are here, and I'm so happy to know that y'all are having those conversations now.
Thank you, Butch. We appreciate you saying that. We're very passionate about trying to solve this issue, but as everyone else faces, there are significant funding challenges to doing that. So, thank you.
Hey, Kevin, this is Kurt Hipple with the department. Just 2 years ago, the General Assembly appropriated about $4 million for sheriffs and transportation for people with behavioral health issues. And that funding is administered by the Office of Criminal Justice Services and the Department of Finance and Administration. So you might want to take a look on their website, or if you want to email Kirby or Avis, we can get you the contact person for that grant.
Thank you. I'm very interested in that. My understanding of that grant is it was kind of built for how sheriff's departments transport patients to regional mental health hospitals. which is a need for sure, but our interest lies in direct intervention at the moment of crisis out on the streets. But I am very interested, sir.
Totally understand. Gotcha.
Yes.
Yeah.
If you could, I'd love to get that contact information from you. Thank you.
Yeah, absolutely. Thanks, Kevin. Yeah, and it's you're right. It's not just the regional mental health institutes. It's however that the sheriff is transporting to whatever resource for those who are being involuntarily committed. But yeah, I totally understand the distinction that you're talking about, and we'll be happy to pass that information along. Kirby or Avis, just get with me, and I can get that to you so you can get to Kevin.
Thank you all.
I have a report for United Healthcare Community Plan. It's a very short report. I just pulled it up and I lost it. Here it is. This is Kubra Carl Bryant from United Healthcare Community Plan. The United Healthcare Community Plan expanded telehealth following TenCare guidance. We also increased support to providers needing to transition patients between levels of care. We had targeted efforts on food deserts in Tennessee with United Healthcare food box delivery. And we have also been holding weekly leadership calls with provider leadership, TAMHO, the department, and TenCare to address COVID response, care barriers, and methods for ensuring access to care. And I can send these bullet points to whoever needs to put them in the minutes. Thanks.
Goober, you can send that to me now that we have our email addresses all working together.
I will do that right now. Thank you.
Okay, sure.
Hey, Kevin, this is Kurt again. I just thought of another resource that might be helpful for your particular topic. NAMI, Tennessee got a direct appropriation from the General Assembly to kind of look at CIT services and expanding them across the state. You might want to talk to Jeff Flayton or Roger Stewart at NAMI, Tennessee. They're the executive director and the assistant executive director, because they've been very involved in, I think, that particular issue that you were bringing up. Sorry to keep on chiming in, guys.
Thank you, Kurt. I appreciate that. NAMI has been instrumental in the development of CIT over these last few decades, so that's certainly someone I should reach out to see about expanding. And just to make it clear, CIT does an excellent job. What we're trying to do is build upon the work they're doing and add a medical piece as well as the psychosocial piece on top of that.
Hey, this is Tom Starling with Mental Health America. Just a couple of notes that the link to our screenings is available. If you need a copy of that link for your patrons or constituents or anybody who visits your email or your website, rather, we have noticed, of course, that the number of screenings is up as well as the severity of the screenings, particularly anxiety and depression and trauma. And for some reason, psychosis is also way up. We're actually going to be hiring in the next couple of months here at MHA for some positions in the West Tennessee area. And I think that's it. Thank you. Oh, one more thing. We actually are still providing mental health first aid for free to all first responders, veterans, and military personnel. We do the adult mental health first aid, but it's free if you need to host mental health, law enforcement or first responders, and we can do that live if it's a small class of 10 or 15. Otherwise, we're also qualified to do it online. Thanks.
Thanks for sharing that, Tom, and everyone with your updates. Does anybody else have anything they want to announce? Okay, I do want to remind everybody that the next Region 7 meeting is October 27th from 11:30 to 1:30. We have already said that we're going to do it via WebEx. Again, that's October 27th from 11:30 to 1:30. And then the next statewide Planning and Policy Council is Tuesday, August 11th from 10 to 2. And that's also going to be on WebEx. Any last thoughts or questions or networking?
TMHCA has been doing a group called the Empower Hour, and it's very helpful for people during this COVID. I've been going every week, and it's very good for expressing yourself. And they bring a different topics, but the good thing is that you're able to network with other people and, you know, and express how you're feeling with this pandemic. Yeah, so if they're interested, it's every Thursday at 1 o'clock from 1 to 2, and it's called the Empower Hour, and you can contact Bruce Hoffman at TMHCA.
Great. Kirby, Butch, Kurt, anybody have anything else? Amy?
I'm good.
All right, well, we will see y'all at the next meeting. Everybody take care and stay well.
Bye, everyone.
Bye.
Bye, everyone.
Bye, everybody. Thank you.
Bye.
Bye.